Assalamu alaikum. Beta, in this video lecture, I will deliver the pre-malignant conditions of cervix. Okay. Previously, talking about cervix, I have delivered, you know, um, a little about the anatomy part, the inflammation of the cervix, and the endocervical polyps. Now comes beta the malignancies of the cervix. In this particular lecture, I will discuss about the pre-malignant conditions of the cervix, that how the pre-malignant conditions develop, that how do they develop, or how do they develop, and how, I mean, what is their appearance, okay, and how they later develop into the malignancy, that is cervical carcinoma. Okay, so we will be discussing about the pre-malignant condition, that is not a malignant condition but has potential to develop into malignancy. Okay, that how it develops and how it appears and how can it turn into complete malignant condition, that is the cervical carcinoma. So talking about the pre-malignant condition, that how it develops, so let me tell you the pathogenesis of pre-malignant condition. You will then better understand that how in cervix pre-malignant condition develops. Okay, what is pre-malignant condition? The condition which has full potential to develop into malignancy, that is cancer of the cervix. Okay, look beta, there are some human papilloma viruses. Two different categories are there. One are the high risk human papilloma viruses, one are low risk human papilloma viruses. By the way, high risk human papilloma viruses are responsible for development of pre-malignant conditions in the cervix. However, low risk HPVs are not really implicated in the development of pre-malignant condition in the cervix. Okay, so high risk human papilloma viruses, especially the human papilloma virus 16, which is implicated up to 60% of cases, and HPV 18 and some other types of HPV, right, they are responsible for the development of the cervical cancer. So these types of human papilloma virus, they first develop the pre-malignant condition in the cervix, and then this pre-malignant condition can develop into complete malignancy or cervical cancer, complete malignancy of cancer, cervix, or complete cancer of the cervix. Okay, so yeah, however, these high risk human papilloma viruses not only produce the cervical cancers, but they can also produce some squamous cell carcinoma at other sites in your body. Okay, they are not only responsible for cervical cancers, they are responsible for squamous cell carcinoma at some other sites as well in your body, like in vagina, vulva, male penis, anus, tonsils, and the oropharyngeal locations. Okay, so don't forget that beta, human papilloma viruses, they are really good culprits for development of cervical cancers, but they can also cause squamous cell carcinoma at these other locations as well. Okay, talking about low risk human papilloma viruses, they are not really responsible for malignancies of the cervix or any other side. Then what do? They are responsible for sexually transmitted warts. They are responsible for sexually transmitted warts called condyloma acuminatum. लो रिस्क HPV से बेटा सर्विक्स का कैंसर नहीं होता, लेकिन वायरल वाट्स ज़रूर बनते हैं. ठीक है, और जो जेनाइटल रीजन पे वाट बनते हैं उनको हम कंडाइलोमा एक्यूमिनेटम कहते हैं. ठीक है, वल्वार रीजन में वाट्स बन सकते हैं, पेरिनियम में या एनस के अराउंड, दैट इज़ पेरी एनल. ओके, yeah, let's go a little ahead. Yeah, look beta, the high risk human papilloma viruses, which I just told you, that these high risk human papilloma viruses, especially type 16, they are responsible for development of the pre-malignant condition in the cervix, and later that pre-malignant condition develops into carcinoma of the cervix. Okay, that is the complete cancer of the cervix. How the story begins, beta. The high-risk human papilloma viruses, they first infect the basal cells in areas of epithelial bracts or immature metaplastic squamous cells at the squamo-columnar junction. If let's suppose, let me explain you what I'm trying to say here. Yeah. Okay. You can see this is let's suppose cervix. Okay. This is cervix. Yeah, this is cervix, and if let's suppose this out is vagina. Okay, this out is vagina. Okay, and this nice is kind of cervix. Okay, right. So this portion of the cervix which is in vagina, this is vagina. This portion of the cervix which is in the vagina, this is called ectocervix, and this portion is called endocervix. This is basic anatomy. I hope you people know. Normally here in this ectocervix part, there used to be the squamous epithelium. Yeah. So if I draw, this is kind of a squamous epithelium. This is a squamous epithelium. Okay. This is the external os. And remember, in endocervix part, there is not squamous epithelium. There is, this is columnar epithelium. Okay. This is columnar epithelium. You remember this from anatomy, that in ectocervix part there is a squamous epithelium, in endocervix part there is kind of columnar epithelium. Okay, right. Look beta, what happens, this is your entire cervix. Where do human papilloma virus infect? Right over there. Human papilloma virus infects in the region if there is any epithelial break or the immature metaplastic squamous cells at the squamo-columnar junction. Let me recap you one very important thing which I have discussed previously, that yeah, there are squamous cells in the ectocervix and there are columnar cells in the endocervix, but what happens with time beta, that these squamous cells grow further and these squamous cells replace these columnar cells, right? So it becomes like this. If I draw it again here, then you see here, this is the vagina and this is the squamous epithelium. This squamous epithelium has now grown further. Now this is the columnar epithelium. Okay, initially there were columnar cells, but now there are squamous cells. So actually what happens, that squamous cells grow further and they replace the columnar cells. So this is the immature metaplastic squamous. These are immature metaplastic squamous cells, right, at the junction of the columnar and the squamous epithelium. This is the complete squamous epithelium, this is complete columnar epithelium. So at the junction of the complete columnar and complete squamous epithelium, in between there is some kind of squamous cells which are now developing. They are immature. Okay, so this is the region where human papilloma virus can infect. Okay, you can see here that human papilloma viruses infect the basal cells in areas of immature metaplastic squamous cells at the squamo-columnar junction. This is kind of immature metaplastic squamous cells that are present at the junction of the squamous and the columnar cells, right? Also human papilloma viruses infect in the regions where there are epithelial breaks. In region where there are epithelial breaks, if I take this part of the epithelium out, then you can see this is the normal epithelium, which this is really healthy and good looking. If let's suppose there is any break in the epithelium, any crack in the epithelium, so through that crack, that virus can enter into the epithelium and can infect. Now you understand that how human papilloma viruses infect. They cannot infect the healthy epithelium. They cannot infect the healthy epithelium. They only infect the epithelium if there are breaks, if there are cracks in the epithelium, or they can infect the immature metaplastic squamous cells at the squamo-columnar junction. These squamous cells which are now just growing, these are immature metaplastic squamous cells. Okay, so yeah, now you understand where can human papilloma virus infect. And don't forget beta, that human papilloma viruses, they directly infect the basal cells. You remember that the epidermis, even I discussed in the dermatology as well, that you have got 4 layers top to bottom, 1 2 3 4 to 5 layers, by the way, 3 4, the layer at the very bottom, the layer at the very bottom in the epidermis, the layer at the very bottom in the epidermis is called basal layer, and the cells in this basal layer are obviously the basal cells. Okay, so human papilloma viruses, this is the entire epithelium, or you say epidermis. This is the layer number 1, 2, 3, and this bottommost layer is the basal layer, the basal layer. Okay, so human papilloma viruses, they come and infect down directly into the basal cells in the basal layer. Don't forget, this is very important point. Human papilloma viruses, they do not infect the topmost cells in the epidermis or the epithelium. They infect the basal cells in the basal layer, right? Okay, so yeah, now I hope you are clear with these two things, that human papilloma viruses, they do not infect the even they cannot infect the healthy epithelium. They infect in the regions where there are epithelial cracks, epithelial breaks, or they can infect the immature metaplastic squamous cells at the squamocolumnar junction. Okay, again, just for your understanding purpose, this is entire epithelium. Here you can see there are some cracks in the epidermis, and at the bottom this is the basal layer. So because there are epithelial cracks, virus can easily enter and can infect the basal cells in this basal layer. Okay, right? Yeah, human papilloma viruses, they infect the basal cells, but do not forget that yeah, they do infect the basal cells, but they do not replicate in the basal cells. Human papilloma viruses, they infect the basal cells, but they replicate in the mature squamous cells, that are the squamous cells in the above layers. Okay, so I hope you are clear, beta, that virus enters through the epithelial cracks and they enter into this basal layer. They infect the basal cells in the basal layer, but for replication they go a little above, and in these mature squamous cells which are in the above layers, the virus enters here and replicates here. Right, now let's go a little ahead, beta, after this. Yeah, okay, I hope it is visible. Once the virus has infected your basal cells, what is going to happen? We actually have to develop the pre-malignant condition, right? This is the topic we have to discuss. So look, beta, the high risk human papilloma viruses, especially the human papilloma virus 16, they have got some very important proteins that are the carcinogenic proteins. So far, what have we done? The virus enters through the epithelial cracks into the most the layer at the bottom, that is the basal layer, and it infects the basal cells. Now you just imagine that the virus is in that basal layer, and that virus has got couple of very important proteins that are carcinogenic, cancer causing proteins, E7 protein and E6 protein. Now I will tell you that what do these proteins do, and how do these proteins can lead to development of pre-malignant condition in the cervix and ultimately the cancer of the cervix. Okay, so one is the E7 protein. What does it do, beta? What does it do? Again, just for understanding, this is the epithelium. This has got so many cracks. This has got so many cracks. And where is your virus sitting? This is the basal layer. These are the cells in the basal layer. Okay, here your virus is sitting right here. Okay, the virus got entry through these cracks, got into the basal layer and entered into your basal cells. And now we are looking into this basal layer and seeing what is this virus doing. This virus has got E7 protein. This E7 protein will bind hypophosphorylated, that is the active form of retinoblastoma, in your basal cells genes and it will promote its degradation via proteasome pathway. So yeah, the virus got entry into the basal layer, entered into the basal cells, and what did the virus do? The virus has got E7 protein, and this E7 प्रोटीन व्हाट डिड इट डू बेटा? ये E7 प्रोटीन आपके सेल के अंदर मौजूद जो न्यूक्लियस है और न्यूक्लियस के अंदर मौजूद जो रेटिनोब्लास्टोमा जीन है उसके साथ जाके बाइंड हो गई और इसको क्या कर दिया, डिग्रेड करा दिया, इसका एक्शन जो है बंद कर दिया। ये वैसे एक ट्यूमर सप्रेसर जीन है और इसके रोल को बंद करा दिया E7 प्रोटीन ने। व्हाट एल्स E7 प्रोटीन कैन डू? E7 प्रोटीन बाइंड एंड इनहिबिट P21 एंड P27, बोथ आर साइक्लिन डिपेंडेंट काइनेस इनहिबिटर्स. So after E7 protein has, after E7 protein is done with these couple of very important, functions, what is the net result? The net result is increased cell cycle progression and impaired ability of the basal cells to repair DNA. Your basal cells in this basal layer, they will keep on progressing. Their cell cycle will be increased very much, and the ability of to repair DNA will be lost, and they will keep on accumulating mutations further. So yeah, virus got entry through the epithelial cracks, got into the basal layer, entered into the basal cells. Then what happened? Couple of functions the E7 protein did. That very first thing what E7 protein did, it bind as hypophosphorylated active form of retinoblastoma और retinoblastoma की डिग्रेडेशन करा दी वाया प्रोटियाजोम पाथवे. दूसरा क्या काम किया E7 प्रोटीन ने, वो P21 और P27 के साथ बाइंड हुई और उसको इनहिबिट कर दिया. इन दोनों कामों के नतीजे में क्या होगा, जो बेजल सेल्स है उनकी सेल साइकिल बढ़ गई और उनकी जो डीएनए रिपेयर करने की एबिलिटी थी वो भी इम्पेयर हो गई. ठीक है, तो इस तरीके से क्या होगा, जो बेजल सेल्स हैं वो आपके बहुत ज़्यादा मल्टीप्लाई करते रहेंगे, करते रहेंगे एंड दिस विल लीड टू डेवलपमेंट ऑफ प्री मेलिग्नेंट कंडीशन, ओके, विच विल लेटर डेवलप इनटू कैंसर ऑफ द सर्विक्स. Sorry. Now let's see what E6 protein can do. Okay, E6 protein of your human papilloma virus, it can exacerbate the DNA defect repair. Yeah, above E7 protein, what did it do? It was impairing the ability of the basal cells to repair DNA. E6 protein just exacerbate this effect. Okay, बेटा E7 प्रोटीन हमने ऊपर डिस्कस की, उसने क्या किया, सेल साइकिल प्रोग्रेशन को बढ़ाया, बेजल सेल्स की जो सेल साइकिल है उसकी प्रोग्रेशन को बहुत ज़्यादा बढ़ाया और उनके अंदर जो अपना डीएनए रिपेयर करने की कुव्वत थी उसको लॉस करवा दिया. E6 प्रोटीन इस चीज़ को मज़ीद एक्सासरबेट कर देगी. E6 प्रोटीन ऐसा बना देगी बेजल सेल्स को कि बेजल सेल्स अपना डीएनए रिपेयर ही ना कर पाएँ. कैसे? E6 protein does it by binding with the tumor suppressor gene P53, yeah, and by upregulating the expression of telomerase enzyme. What happens with this, beta? When the E6 protein, it binds with the tumor suppressor gene P53, E6 protein actually promote the degradation of P53 by proteasome pathway. So once the P53 is lost, the net effect will be increased cellular proliferation, acquisition of further mutations leading to the cancer development, and impaired ability to repair the DNA. And also, this E6 protein can upregulate the expression of the telomerase enzyme. When the telomerase enzyme is increased, there will be cellular immortalization. What does telomerase enzyme do? Telomerase enzyme का काम होता है जो आपके डीएनए में मौजूद टीलोमर्स हैं उनको बरकरार रखना. और देखें ना बेटा, ये आपका सेल है, सेल के अंदर न्यूक्लियस है और उसमें आपका ये डीएनए मौजूद है. डीएनए के जो कैपिंग होती है उसको टीलोमर्स बोलते हैं. जब तक ये टीलोमर्स बरकरार होंगे, ये कैपिंग जो है ये टीलोमर्स बरकरार होंगी, तब तक आपका सेल मल्टीप्लाई करेगा. ठीक है, और एक वक्त आता है कि आपका ये जो टीलोमर्स हैं वो लॉस हो जाते हैं और इस सेल की डेथ हो जाती है. ठीक है, लेकिन टीलोमरेस एंजाइम का क्या काम होता है, इस कैपिंग को, इन टीलोमर्स को बरकरार करके रखना. तो आप फ़र्ज़ करें बेटा, जब टीलोमरेस एंजाइम बहुत ज़्यादा होगा तो ये कैपिंग भी बहुत वक्त के लिए बरकरार रहेगी और सेल की कभी डेथ ही नहीं होगी. सेल इमॉर्टलिटी में चला जाएगा, इमॉर्टलाइजेशन में चला जाएगा. इससे क्या होगा, सेल मुसलसल प्रोलिफरेट करता रहेगा, उसकी डेथ होगी नहीं. और जो सेल ज़्यादा से ज़्यादा प्रोलिफरेट करता है उस पर ज़्यादा से ज़्यादा म्यूटेशंस होने के खदशात होते हैं. एंड वंस यू डेवलप द म्यूटेशन, you will develop the pre-malignant condition and ultimately the malignant cancer. Okay, right. Yeah, this is how pre-malignant condition of cervix develop beta. Now let me recap it with you very quickly. I told you that, okay, yeah, from here I told you that this is the epithelium with some little cracks right over there, and through these cracks virus got entry into the basal layer, and after entering into the basal layer the virus infects the basal cells. Okay, once virus has infected your basal cells, virus has got E7 protein and E6 protein, and these E7 and E6 proteins are responsible for development of the pre-malignant condition of the cervix. And you know what beta, what did E7 and E6 protein do? E7 protein ultimately increases the cell cycle progression and impaired ability of cells to repair DNA. You can see the cell cycle has been very much increased. Cell cycle has been very much increased and their DNA repairing ability is also lost. If we talk about the E6 protein, what did it do? Yeah, same. Increased cellular proliferation, further mutations, and cancer development. These E7 and E6 proteins are of your high risk human papilloma viruses. The E6 protein of low risk human papilloma viruses, they fail to bind with P53. Like your E6 protein of high risk human papilloma virus, they can directly bind to tumor suppressor gene P53. E6 protein of low risk human papilloma viruses, they fail to bind with P53. Then how do they participate? They instead they dysregulate the growth and survival by interfering with the notch signaling pathway. Okay, notch signaling pathway, right? I hope you are clear so far, beta. Now I hope you are clear with this, right? Now gets a little ahead after this. Yeah, there is another factor beta that can contribute to malignant transformation by the human papilloma viruses is the physical state of the virus. Is the physical state of the virus. That is, viral DNA integrates into the host cell genome. If let's suppose this is the basal cell and this is the genome of the basal cell, and if this is the viral DNA of the human papilloma virus, so what happens? This viral DNA integrates into the human genome, into the basal, into the genetic material of the basal cells. What will happen once this viral DNA is incorporated into a human genome? Yeah, what will happen with this beta? There will be increased expression of E6 and E7 proteins plus dysregulation of nearby oncogenes. Once the viral DNA is incorporated into this human genome, what will happen that जो viral proteins होती हैं जो पीछे हमने डिस्कस की E6 और E7, जिनका काम था सेल साइकिल को ज़्यादा करना और प्री मेलिग्नेंट कंडीशन डेवलप करवाना, इन E6 E7 की जो एक्सप्रेशन है वो बढ़ जाती है। और ये जो बेटा वायरल डीएनए इनकॉर्पोरेट हो गया है यहाँ पे, ये आसपास के जो ऑन्कोजीन्स हैं, फ़र्ज़ करें यहाँ पे MYC जीन मौजूद है जो कि एक ऑन्कोजीन होता है, ये वायरल डीएनए इनको डिसरेगुलेट कर देता है और ये भी बेटा पार्टिसिपेट करता है इन द डेवलपमेंट ऑफ प्री मैलिग्नेंट कंडीशन. In the end, you need to know beta, cervical carcinoma, the complete carcinoma of the cervix. This is the third most common cancer in women, and the progression from the precursor lesion to the complete invasive carcinoma is slow. Okay. So now, so far, what did we learn, beta? What did we learn so far? That here, let me tell you. In this particular lecture, I told you that how in the cervix pre-malignant condition develops. Okay, and now let's quickly recap that how this pre-malignant condition develops. It is, but just let me know what is this pre-malignant condition. What is this pre-malignant condition? What is happening in this pre-malignant condition? Cell cycle progression is increased. That means cells in the basal layer have been multiplying very much, and also the DNA damage is occurring, और डीएनए डैमेज तो हो रहा है लेकिन वो रिपेयर भी नहीं हो पा रहा. ठीक है, दिस इज व्हाट हैपेंड इन द प्री मैलिग्नेंट कंडीशन, एंड नाउ इफ दिस स्टेज फॉर लॉन्ग टाइम इट विल डेवलप इनटू द कैंसर. ओके, एंड हाउ डिड दिस अकर? This occurred with the help of E6 and E7 viral proteins of the human papilloma virus. Okay, and the remaining story you know well beta. Okay, in the very next lecture we will discuss about how does this appear, the classification of the pre-malignant condition and its appearance. Okay, so far you have learned that how does it develop, and in the next lecture you will understand that what is its appearance and what is its classification, right? That's all about this lecture, beta. Thank you so much. Class dismissed.